There are medicines that will help people become successful when quitting smoking, and research has shown that medicine can help you try and quit. If you're thinking about quitting smoking and you need help quitting, it's really important to sit down with your doctor and ask them a bunch of questions. If you're pregnant, nervous, or have other health problems, it's really important to discuss that with your doctor first. You don't want to use any medicine if you are trying to quit smoking. But what are your medicine options? There are different medicines that will help you quit smoking, which are nicotine replacement therapy. Nicotine replacement therapy. For example, you could use the gum, a lozenge, a patch, an inhaler, or a nozzle spray. The gum, the patch, or the lozenge, you can buy that at a drugstore over the counter. If you use an inhaler or a nozzle spray, you'll need to go see a doctor and get a prescription for it. Those medicines will help your withdrawal symptoms less. If you feel tempted or cravings, it will also reduce your temptations or cravings. If you look on the directions and follow the instructions very carefully, you'll be fine. If you want to use the gum, the lozenge, or nozzle spray, or inhaler, you shouldn't smoke at all. People will sometimes use a nicotine replacement and maybe experience dry mouth or a sore throat. If you use a patch, sometimes the skin will become red or itchy. Another medicine called Zyban, you'll need to get a prescription from your doctor if you want to try that. That medicine will help with your withdrawal symptoms and also help with your temptation and your cravings to smoking. So how do you use? Well, 1 to 2 weeks before you decide to quit smoking, start taking the medicine. And then you quit after 2 weeks, you stop smoking, but then you continue to take the medicine 6 months after you smoking. People will use Zyban. People who use Zyban will experience dry mouth, they won't be able to sleep. If you have seizures or you toss and turn in bed, or you have eating problems like anorexia or bulimia, you shouldn't take the medicine. Another medicine called Chantix is a medicine that will help you quit smoking. You also need to go to the doctor and get a prescription for that as well. The third medicine is very different. It has no nicotine in it at all. So how does it work? Nicotine affects the brain. When you take the medicine, it will block the receptors in your brain so you don't feel like you have nicotine in your system. So how do you use that medicine? Start taking the medicine 1 week before you're about to quit smoking. And then quit after a week, and then continue to take the medicine about 2-3 weeks after you have quit smoking. People who use Chantix sometimes will experience stomach aches, they won't be able to sleep, they'll have gas or they'll be constipated. And it also makes you have crazy dreams.